We acknowledge this is very much a for-nation delivery, and we've invited Professor Marion Bain as the Deputy CMO for Scotland to come and speak to us. Marion is a public health doctor and is a professor at the University of Edinburgh, has been the Executive Medical Director at the NHS National Services in Scotland, and now leads on many of the aspects of data research, data set delivery in Scotland, but is going to take us through some of the delivery of care within Scotland. Marion, thank you very much for coming.
Mike, have you got the clicker? Oh, thank you. Okay. So, well, thank you. It's good to be with you this afternoon, and all I'm going to do is just very briefly, I wanted to say something about the Scottish policy context for improving the quality of healthcare services and the associated medical training round about that. What I wanted to start with is the 4 key population challenges that the CMO in Scotland has set out. I think they provide a really good context for what we're thinking about. So those 4 areas are first of all, the threats caused by infectious diseases. So we were all very well aware of that during COVID, but it's not gone away. We continue to have existing infectious diseases and new infectious diseases that are a challenge and will be a challenge for us. Second key challenge is round about population health, how we improve healthy life expectancy and how we tackle health inequalities. Third key challenge is all about how we deliver sustainable health and care services. How can we do that? And that's in the context of what we see in terms of this really relentless increase in the intensity of clinical practice. And then fourthly, the focus on the challenge of the sustainable use of resources. How do we reduce adverse impact on climate and biodiversity? So think about Scotland, and some of this applies in other parts of the UK, but in Scotland certainly the context for our health is the situation's really stark. We've had trends in health and in terms of early deaths and inequalities that were looking quite positive. We had very positive trends in terms of early deaths and inequalities reducing up till about 2014. But at that stage it stalled, and then more recently we're actually seeing things getting worse. So we are seeing this trend which is not good. Within Scotland we've also looked at the future burden of disease, and estimates for that forecast an increase by 21% over the next 20 years. So that's 21% more than we have currently in terms of the burden of disease. And that's mainly due to increases in cancer, cardiovascular disease and neurological conditions. So undoubtedly there is a need for reform. Thinking about people in Scotland, and again more widely, and already been mentioned, we have an ageing population. Alongside that, we have that picture of reducing healthy life expectancy and excess deaths. Health trends, we're seeing that pattern in terms of what's likely to happen with disease burden, but also the changing demography with a higher proportion of older people in our population. And when we think about models of care, the current models need to change. We do see variation, certainly in Scotland, variation across the country, and I'm sure elsewhere. And not all of that is warranted variation in terms of local circumstances. But that change that we need to see in our models of care, it won't be delivered simply by more improvement work or more focus on productivity and efficiency where that's possible. The change that's required exceeds what can be done with that. Our workforce generally, our medical workforce, there are significant workforce gaps across the system. And so we need to look at a long-term resourcing plan. And then sustainability, and by this I'm thinking about financial sustainability. And again, we need to reform. It's not enough just to improve how we deliver health if we're going to be able to meet those demands in our services. So there's a balance of challenges across the system. There's an immediate need to think about the financial position that we find ourselves in, but in the longer term we need to balance that with the need to overall improve our population health. We need to do much better at workforce planning, and we need to be transforming our models of care to meet those changing needs. But also importantly, to look at what's possible in terms of opportunities, and thinking in particular of digital innovation and what that can deliver. So within Scotland, there's a commitment to 3 key documents that will be coming out shortly. First of all, there's an operational improvement plan, so that's focused on the short term and is due to be published shortly. Alongside that, there's a population health framework which will be published probably in May, towards May time, and that's really focusing on that bigger picture of improving the health of our population, tackling health inequalities, and genuinely getting upstream in terms of prevention and investing in that to reduce pressures. And then the third key document is a longer term framework round about transforming and reforming our health and social care services. And so underlying all of those is a focus on improving access to treatment for those who need it, shifting the balance of care where possible away from acute care into community and homes, a much stronger focus on prevention, and also, as I said, taking advantage of the opportunities within digital innovation to deliver services. We've seen post-COVID many lasting effects. So there have been lasting effects for individuals, there have been lasting effects for society as a whole, but there also have been lasting effects for our health services. And services, of course, are still trying to catch up with backlogs. And as has been mentioned already, we're seeing higher morbidity in our patients and more comorbidity. And the workforce, which was pressed during COVID, continues to be stretched. So supporting our workforce has to be a crucial priority. And in Scotland, we've got this joint Scottish Government and Convention of Scottish Local Authorities plan for the workforce roundabout, specifically supporting roundabout mental health and well-being. Just a word about health and social care in Scotland in terms of what that means for a unique Scottish context for training. Now, the internal medicine training is of course provided to the same curricula and standards across the 4 nations. But in Scotland, with the variety of settings, so we have training delivered across large teaching hospitals, district generals, but also small, rural and island hospitals. And alongside that, there are specialty networks and communities of practice relating to geography. So those training in Scotland can benefit from working in small teams, but also benefit from those national networks and a very close collaborative working between undergraduate and postgraduate training. And alongside that, there's close working between the deanery teams and the directors of medical education and boards, which is so important in supporting effective quality management systems. I wanted to say a word about educators and trainers, and just to emphasise that, of course, the role of educators and trainers is essential if we're going to support high quality medical education and training. So those individuals have a key role in ensuring patient safety through training, but also in terms of assessment and mentoring colleagues alongside pastoral support and career guidance. And those roles definitely can be undervalued in a system under pressure, such as the system we're seeing just now, and where clinical activity and direct patient care are prioritised. But we do need most definitely to value those individuals, and we need to invest resource in the essential role that they deliver. And fundamentally, if we're going to transform our services in the way that I described earlier, it needs us to invest in our future workforce, and that means those also who support high quality medical education and training. Within Scotland, my Scottish Government Health Workforce Policy colleagues are looking at exploring how best to support those colleagues as part of a wider piece of work. They've been looking at understanding the current challenges and how to effectively plan and train our future medical workforce for those service and population needs. So lastly for me, in all of this, I think it's undoubtedly the case that collaboration is key. So in thinking of collaboration across Scotland and the wider UK, collaboration between the colleges, for us in Scotland with NES, NHS Education for Scotland, our NHS boards, Scottish Government, working with partners such as the GMC, and really importantly, doctors in training themselves. So I'm sure that the rest of the discussion today will be really helpful in taking forward that collaborative approach. Thank you.
Thank you, Marion. Any questions for Marion? I'm always delighted to hear the word collaboration. I think it's really important as we're trying to get across all of these issues, that how we make sure that our quality criteria are being taken forward, but it has to involve everybody. Any questions at all? If not, thank you very much, Marion.